Have you ever noticed that there is like a little yellowish crust on the lower side of your teeth, like the bottom teeth, and you try to brush it really hard and it's not going away? And you're brushing, you're flossing, you're using a mouthwash and it's still there, it's not going away, and you put your tongue there and it feels rough. Well, we're gonna talk today about tartar and how we can prevent it from happening. Before I keep going, make sure you put code 93 to get a free consultation in our office, Blanche Dental in Princeton, New Jersey. And before I move on, my name is Dr. Saad. I am your host today of the Wonder Tooth podcast. And today we are going to discuss what is tartar, how we can prevent it, and what exactly is going in your mouth and your oral biome. So first of all, what is plaque? So if anybody really knows what's plaque, write it down here in the comments below and let me know. But basically, plaque is the soft, sticky little substance that sits around your teeth. So let's say you brushed, you flossed, and you went to bed, and you wake up in the morning and you put your nail basically on your teeth, and you're gonna start to see like a little whitish thing. What is that? It's plaque. And what is plaque? What is it made of? So plaque is basically made of food debris, bacteria, little saliva protein, little bit of enzymes, but most importantly, sugar and carbs. They feed plaque. Okay, you eat more sugar, more carbs, and then you will start to get more plaque. And this is really, it's in the books. This is scientifically noted, it's scientifically proved. And how can we get rid of this? Because now plaque is not good, because what is going on, the bacteria are sitting in it, and then it starts to create a little matrix, and the more bacteria come and they sit on it, and then calcium comes from the saliva, phosphorus comes from the saliva, and they form what we call a lattice. And this is when it starts to become harder. So you see, when the plaque is still soft, you can brush it off and it's gone. Let's say you don't brush for like a couple of days, it starts to build up more and becomes a little bit thicker. And then if you don't brush it, then as I said, the minerals start to come and it becomes a little harder to remove. And this is gonna be a big problem, because this is not just a piece of stone. There is actually millions of bacteria that are sitting in there and doing what they love to do most, which is harming your teeth and your gums and your body too. So where does it usually, like the most important locations for calculus or buildup or tartar? And calculus is not the math calculus, it's calculus, it means like little stone, basically like little cement parts that are, they start to form around certain teeth, specifically certain areas. And where are they? Mostly it's in the lower front teeth, the bottom front teeth from the inside. And why is that? Because down there you have salivary glands called the sublingual salivary glands, and they shoot saliva there. So remember when I said the saliva, they have minerals in them. So okay, you're giving them the best spot now. So they're shooting saliva there. Ooh, we found plaque, let's sit there. And then they start to sit. And the same spot is also the second molar. So if you pull your cheek and you look at your second molar, which is the tooth the second from the back if you have a wisdom tooth, this is where the duct of the parotid gland is. So your parotid gland has a little duct that shoots saliva too, and this is exactly opposite to it. So the duct is in the cheek, right opposite to that side. And this is when you can sometimes put your tongue and you feel like, I feel something rough there, I don't know what it is. And sometimes even when you brush, you start to feel like little pieces, and you come to the dentist like scared. It's like, I think I broke my tooth, and you come and you show him, and he's like, that's not a tooth structure, this is calculus, this is buildup. And this is bad, very bad. So now we know where they are. Now, if you have also like crowding, like some serious crowding, let's say you brush, you floss, you're doing everything you can, but you have crowding, your teeth are kind of on top of each other, they're overlapped. This is the perfect, beautiful spot for the bacteria now to sit and beautifully make this buildup. So what do we do now? Oh my God, how can we get rid of it? You see, this is the issue. Plaque, when it's still soft, you can remove it very easily. You brush really well, you floss, you use a little bit of mouthwash, you're good to go. It's gone. And then this is when you put your tongue and you feel, oh, it's nice and smooth, everything is clean. But if you don't brush it often, or you don't floss, it starts to build up and it's almost impossible for you to remove it. And this is when you have to go to see the dentist or the dental hygienist so that they can clean it up. They have to remove it. And how do we do that? We have like few instruments. We have like hand instruments. We have a cavitron, which is like a little ultrasonic. And basically we start to kind of break those little pieces of cement, and then we go with the very thin instrument to kind of smooth everything. Then we go with a little polishing tip to kind of smooth everything so it's nice and smooth. And then you go home and you do exactly the same thing again. And then what? It starts to happen. Now the problem with that, once the plaque and the bacteria and the buildup sits there, the bacteria also, they start to produce more acid and enzyme to destroy the gums underneath it. And then when the gums start to that happens to the gum, then the bone underneath it also starts to go away and shrink away. And this is when you start to have buildup or tartar under the gum line, which is called subgingival tartar. And if we see that, so even if we clean the top part, you cannot go underneath it. And this is when you need to get a deep cleaning, scaling and root planning. And you can listen to one of my other episodes about what is gum disease, what is periodontal disease, okay? So it's very important now to understand something about the saliva. There is millions of bacteria that lives in your mouth, okay? Your saliva is supposed to be more alkaline, which means they are supposed to be, so neutral is 7 and acidic is less than 7 and alkaline is more than 7. So your saliva is supposed to be around 7.2 or 7.3 to have good, basically good saliva. Sometimes you might have to get a test done to make sure that your saliva is alkaline, because if you have acidic saliva, which is I'm going to explain to you, you are more prone to more cavities, more buildup, more tartar, okay? So the pH is very important. How can we keep the pH as it's supposed to? Sugar and carbs. It's like number one suspect here, okay? Why? Because if you eat sugar and carbs and you're not brushing and flossing, they start to ferment and then they basically produce lactic acid. I don't have to say no more, lactic acid. So there you go. So the acid now is more in your mouth and it starts to disrupt the biome, the oral biome, the bacteria in your mouth. And then your saliva start to shift. Okay, I was alkaline and happy. Now I'm starting to shift into more acidic. And this is when bacteria starts to thrive. Oh my God, this is like the feast for them. Now, there are different types of bacteria. There are bacteria that lives in the air, then there are bacteria that lives in no air or no oxygen. The ones that live in the air, they're called aerobes. And the one that live in like underneath there, it's called anaerobes. Like basically they don't like the air. And this is very common also in case you have like an infection or like an abscess. Very, very important to know that too, because the most the biggest suspect is really the anaerobes. If they start to multiply and get active, this is when you come with the big swollen face. So the anaerobes are very, very dangerous. Okay, so now we understand that we need to keep our saliva alkaline. Now, what if you have dehydration? You're not drinking enough water. I like to drink soda. Well, soda has acid. I love to drink tea and coffee all the time. You're not drinking water. So there you go. They have acid too. So you are basically putting more acid and you are harming your body more than you actually know. So when you have the dehydration, then you're not getting your first line of defense, which is the saliva. And saliva, as I said, it has immunoglobulins, which is your very first line of defense. It prevents bacteria from sitting on your teeth. It kind of lubricates them. It washes them away. And the immunoglobulins, it basically protects your tissues, just like when you have your skin, that little epithelial, the epithelium that's protect your body underneath it, okay? And it makes your teeth basically clean and smooth, the bacteria, because it's washing everything. So when they're nice and clean, the bacteria, they don't like it. They like rough surfaces. So when you have dry mouth, then it's a very big problem, because now you have lost your line of defense, and now you have rough surfaces that the bacteria love to sit on it. So what do we do? How do we get rid of dry mouth? Unfortunately, dry mouth is linked with a lot of medication. Pretty much any medications you're taking gonna have a side effect, dry mouth. So what do? You have to talk to your medical doctor about that. Maybe they can adjust the dosage, or maybe they can give you something with less side effects. Drink plenty of water. What? Water. Not coffee, not tea, not soda, not Gatorade, just plain water. Then there are also some lozenges that you can buy, something, you know, for dry mouth. There is also something, I had a patient yesterday, I really suspect she has what was called Sjogren syndrome. What is that? When you start to have like really dry eyes, dry mouth, and you have a little bit of arthritis. All of this is called Sjogren syndrome. It's an autoimmune disease. You have to talk to your medical doctor if you have that. You really have, and if sometimes, you know, you see like a medical doctor, like a family doctor, then you see your dentist, and nobody is really linking things together. But that's why we have this podcast. I want you to understand. If you have dry mouth, if you have dry eyes, if you're starting to get some arthritis or osteoporosis, you have to talk to your doctor, your doctor, you know, say, you know, maybe I have Sjogren syndrome. Okay, so this is very important. So we need to increase the salivary flow. How do we do that? Okay, of course, first we're gonna brush really well. We're gonna floss really well. Then there are certain things that you can do to increase the salivary flow a little bit. And how we can do that. If you have actually Sjogren syndrome, you might have to get like a biopsy of your salivary gland, or even like they can inject a dye to check your salivary flow. So we need to see if you actually have real dry mouth, or this is because of Sjogren syndrome, or because we have a problem because of the medications we're taking. Okay? All right. What else? There are certain things that you can start to do to increase a little bit, you know, making the teeth a little bit clean. Like what? Like xylitol. I mean, a lot of dentists, they are talking about the effects, you know, of xylitol. So xylitol is like it's a sweetener, you know, we use it here and there. And basically there are some proven results that said that, you know, if you use like a little chewing gum, it keeps your teeth, it keeps it clean. Or a mint, it actually stimulates your salivary glands to produce more saliva. So this is very important now. But of course, you don't want to overdo it, because, you know, it's linked also with other medical problems. Okay? So xylitol, you can get, you know, like the mint or a chewing gum. You can start to use it here and there, and you're gonna actually start to see a little bit of increase in your salivary flow. Okay, and that's basically your first line of defense against any bacteria in your mouth. What else? Hydrogen peroxide. It's not gonna increase your saliva, but it's actually going to make the saliva more alkaline rather than acidic. So it can shift your pH a little bit. Now, hydrogen peroxide is very natural. And remember when I said there are some aerobic bacteria which they live in the air, and the anaerobes that they don't live in the air, they don't like the air, and they are the dangerous ones. So hydrogen peroxide, it has an extra oxygen, so it can basically shift your pH or your saliva pH from acidic to alkaline. And then what? Then your oral biome are better. But if you keep doing, like if you overdo it, then you can completely shift, you know, the bacteria in your mouth, and that can harm the bacteria, the beneficial bacteria basically. Now, hydrogen peroxide is very strong, so you cannot like swish with it like that. You have to put, I would say, like a tiny little bit in a cup, and then fill the rest with water. Just a little bit. And if you guys are like listening to us, we are on YouTube also, the Wonder Tooth podcast. So just a little bit, I would say maybe like 5 ml, and the rest is water. Okay, and you can rinse with it, swish with it. I wouldn't do it every day, maybe a couple times a week, just to kind of keep everything fresh. There is also the oil pulling. So, you know, coconut oil, it has some antibacterial effect, and you can use it too, if you can, you know, for like 5 minutes a day. Maybe don't overdo it also. I'd rather maybe every other day or 3 times a week, kind of to keep, you know, everything nice and smooth. Because the big thing is we don't want to give the environment for the bacteria to sit and cause that lattice and basically get the phosphate, you know, the phosphorus and the calcium from the saliva to create those tartar buildup. Okay. And what else? Sometimes, you know, they say baking soda. I don't really like baking soda much because it's very abrasive, but you can, if you have a little time, maybe once a week, just kind of brush with it, or you can rinse with it, put like a little bit of the powder in a cup of water and just rinse with it really, really well. But I wouldn't really brush because it's very, very abrasive, and it can remove the outer layer of the enamel, and it can makes the teeth pretty sensitive down the line. It's very strong. And as I said, oil pulling, you can use, as I said, the coconut oil. You can also use some cinnamon oil or oregano oil. You can add like a little drop, you know, on water and use it to rinse with it. Okay, so these are certain like pretty much DIY thing that you can do at home. But of course, you have to go to see your dentist every 6 months if you don't have gum disease. If you have problems like gum disease, or you have diabetes, or you're pregnant, you might want to go more than that. Like I would recommend every 3 months or every 4 months. So you have to talk to your medical doctor and your dentist about that, especially diabetes and gum disease. They just love each other. So you can also watch one of my episodes about the relationship between diabetes and gum disease. All right, so now what are we gonna do? What's the regimen now to basically prevent tartar from happening? We're gonna brush twice a day, like really, really well. We're gonna floss every night. Floss really well, you know, make sure you get into those tiny little areas. You can use a xylitol mint or a chewing gum every now and then. You know, don't overdo it, because also xylitol can put your body at a risk of clots. So if you already have, you know, clotting problems, or if you're taking baby aspirin, maybe it's not for you. Okay, but just make sure you brush and floss really well. And if, as I said, if you have any buildup, like you have a lot of buildup, that means carbs and sugar, they need to be cut down a little bit, guys. Okay, and it's good for your body anyway. We don't want the strep mutans, which is like #1 bacteria in the whole universe, which can cause cavities. And basically, just you have to get your checkups done. You gotta just monitor what you're eating and take care of yourself, really. And as I said, certain stuff, don't overdo it. Okay, even if it's over the counter or you're watching another podcast, just don't overdo anything. Take care of yourself. Okay, and as I always say, take care of your teeth and your body so that they can take care of you. I hope you enjoyed this episode, and I will see you again soon. Keep smiling with Dr. Saad. Have a good one, everybody.